All right, welcome back. I hope you're enjoying the conference so far. Our next speaker is Amit Joshipura. He is product and commercial lead at Dexcom. Please join me in welcoming him to our virtual stage.
Welcome, Amit.
Thank you.
How are you doing today?
I'm doing very well. Very happy to be here. I'm excited for our conversation.
Me too. Thank you all for joining. Just to kick it off, basically, I'm Daniel Lackland. I'll be just being the question asker. And Amit, without any further ado, if you would just give a little bit of an introduction, who you are, what your role is, and why you're presenting in an AI for Healthcare conference, that'd be awesome.
Yeah, of course. Yeah. So name is Amit. Live in sunny San Diego. I've been working in product management and product marketing in the med tech and health tech space for over 10 years. Lucky to work with some great companies, Medtronic, which will be the scope of our conversation today. Also Fitbit, which was great. Nice to take a small detour and work in high tech, consumer tech, and see what they were doing and how they could get into healthcare. And then currently I'm at Dexcom, like Patricia said, leading product and commercialization for some of our exciting diabetes products. And so yeah, it's a cool space, and obviously, speaking of AI for healthcare is really relevant because AI is, it's happening in every industry, but I think healthcare applications of AI are super exciting, super impactful, but super challenging because healthcare is challenging, and working with people's data and people's health is a very important and honorable mission, but requires a lot of data privacy and ethical discussions as well. So yeah, it's fun to think about how we can use our technology to help people, but also make sure it's ethical and integrable when we do it.
Excellent. Thank you so much. So let's jump right into it. How do you think about AI within the context of healthcare innovation?
Yeah, so I think it needs to be not just like a buzzword. I think a lot of companies want to get on the AI bandwagon because they think it's like a strategic must do, to kind of stay in the conversation and stay relevant. But I think the companies that do it well are the ones that really understand how the AI is not like a core strategic focus, but more like an enabler of what their already core vision and goals of the company was. So I see AI as more like an enabler versus like a pure like directive or like a mandate that you have to have AI in your health technology and health innovation. Because healthcare is challenging, and it's obviously we're playing with people's lives, and where we can bring AI to improve outcomes and improve user experience and improve predictive capabilities to get ahead of people's conditions and diseases, so they're not going to the hospitals as much or needing more life-saving procedures and surgeries, I think is awesome. But we also have to recognize that people are very complex, like the human body is complex, people's health are complex, it's very heterogeneous, it's very specific. And so there's potential to overlook some important things by trying to automate or systemize or leverage AI models to bring efficiency to healthcare delivery and innovation. So I think just done right and done responsibly, I think AI could be a game changer and help people engage with the healthcare industry and health tech a lot more, excitedly and more ubiquitously. But I think companies have a responsibility to make sure that it's not done just for their bottom line or just for them able to reap the benefits and the cost efficiencies and the P&L improvements, but it's like really for the greater good of the entire population. So yeah, we have great technology. There's a lot of research, a lot of data being collected on people, and with the advent of wearables and stuff like that, like we just have a lot available. But again, so we should use that. We should harness that power, but do it in a way that's responsible.
Great. Yeah, thank you so much for all that context. Amazing. Can you tell us a story about a time when you worked on an AI project that had to do with medical devices? What was the problem? What happened? And any other context you would feel comfortable sharing about that project?
Yeah, absolutely. Yeah. So at my time at Medtronic, I was leading our efforts in diabetes. There's a technology called continuous glucose monitoring that allows people to have a wearable, a sensor that gives their 24/7 glucose readings delivered to their phone, which is super powerful for people that are trying to manage their glucose numbers and manage diabetes. It's a lot of mental burden. There's a lot of things to think about, a lot of decisions to make in the moment. And so to have a tool that's giving you a a view of how your body's doing in the moment, like 24/7, is super powerful. We had actually launched a partnership with IBM Watson, which is obviously, I argue, probably one of the most famous AI platforms in the world. They have a lot of different applications. They do Watson Health, Watson Finance, Watson Music, etc. And so for us to work with Watson Health was pretty powerful. The goal was to actually take all of that glucose data, because we have a bunch of people on the platform, on the system, and it allows, we fed all that data into the Watson machine, the Watson platform, and performed algorithms and formulas and cause and effect capabilities, like reading what people were doing in their lives and how that affected their glucose, and delivering insights and delivering in the moment notifications that was able to churn through all of that significant data and process everything, and give people information that was super actionable, right? Because that's ultimately what AI, I think, is the most powerful or beneficial to, is that people have a lot of data, like they're overwhelmed by data for the sake of data. But if you can take it and turn it into something where you can connect the dots across all the stuff they're doing, you're going to have a really powerful way to deliver meaningful information. And so, yeah, we leveraged Watson Health. We were able to take inputs of like what they ate, what they drank, because there are about like 50 plus things that affect your glucose at any given time. Stress, lack of sleep, lack of exercise, whatever activity you're doing. And so, there's any multiple reasons why your glucose is going the way it is, and it's not managing properly. And so if you have this, partner in crime, or this partner tool that can take all of your data, can take your inputs, and then be able to, provide you, correlations that no layman person could process in their head, because we just can't track all that stuff. And then give you, really real-time insights, real-time capabilities. You're going to have a huge benefit. It's just going to take a lot of burden off. You're going to have a lot better of a time, making the right decisions, because you've got, the tool in hand. So, yeah, it was really cool to think about how their computing power could be applied in a way to help people, because there's just a myriad of decisions that people are making at any given time. So, yeah, it was very innovative and a cool way to launch a project into the market.
Yeah. Thank you so much for sharing that. Two quick questions to follow up on that. So was this, first question is, was this a wearable technology? What was actually the product itself? And then the other question is, where were you sourcing the data from that you were using to actually inform the model so that it was helpful to the patients themselves?
Absolutely. Yeah. So yeah, it is a wearable. It's a hardwired device that you put on your stomach or in your arm. Several companies have this offering. Yeah, so there's a small needle that goes into your body, and that's actually what is measuring the glucose in your system. And there's a small hardware device that's a transmitter that connects Bluetooth to your phone, so that there's a constant glucose reading in the app. So there's an app as well. And so we have thousands of users, and so we have 24/7 readings of their glucose that they use. And what that allowed for was us feeding that 24/7 CGM readings to the Watson Health system. And what informed the Watson Health group was years of research. We have tons of clinical scientists that understand what the body does, based on food and exercise and etc. And so applying that those formulas and those algorithms so that Watson can start to make those connections. And some of it was also like just self-learning or adaptive learning, where the Watson machine would start to recognize patterns, right? Some of the stuff is like, we were also informing clinical folks, like this is what the machine is recognizing from people's data. Because again, like before CGM, we didn't have all this data at our fingertips. So we're learning so much more about how the body reacts to sugar, because we didn't have that before, right? And so we're informing the clinical community based on technology, but then also they're helping us inform the formulas to tell the machine, so that it's kind of like a partnership. So they would leverage, and honestly, the AI the power of AI is just that they can process data, like terabytes of data in seconds, right? And they can see patterns, and they can look across previous years of data. They can do a lot of recognition across different they could see different people's data and make connections across general populations and spit out information. So yeah.
This seems like an amazing effort towards the personalization of care and giving people control over their own health. You also, I think in the first question, or in your response to the first question, you talked about AI being very challenging. So given this amazing, endeavor, was there something that sticks in your mind that was very challenging about this and that you could relate to the entire AI innovation industry and just say, this is the hardest thing that I continue to see when it comes to using AI in healthcare?
Yeah, I mean, I think there's a couple of things. I think one thing is, again, just I think we have to get people to want to share information. Like we have to get people to tell us what they're doing so that we can then take that information and give them meaningful feedback back. And changing habits and having people like log food or track calories or like there's a lot of things that we need people to do. Because people are not robots. And so, AI depends on data, right? And so, there's a reason why AI, I think, applied in like other industries is so powerful because, you have robots or machines, or, you have a lot of like, you can get a lot more data, but with people are the hardest variable to manage because we're irrational. We make our own decisions and we do whatever we want. So I think applying AI to health is trying to control a variable that is the most uncontrollable in the world, because machines and robots and devices do what you tell them to do because they're designed by humans. But when the focus is a human, then you have to start bringing all those variables. So I think there's that piece of it, because our models, our algorithms are only as powerful as what we get information from the users. So like there's a whole like user experience element that, you have to think about. I think the second thing is, the ethics of what we're promising, right? Because I think there's like the risk of, over committing or over delivering the promise of AI to like cure cancer or, cure AIDS or, what have you. And I think we're going to get to a stage where AI can, help. At Fitbit, for example, I worked on an algorithm program to predict COVID-19, right? We did COVID-19 studies because we have data on people and we see what their bodies are doing, and we can use algorithms and machine learning to give people warnings if we see that their body is doing things that they don't even realize, right? Their body is mobilizing to fight COVID-19, and so we can give them that indication. But it's risky because there's going to be false positives, and it could be that maybe your body's just trying to get better from like a cold. So like ethically, do I feel comfortable committing, or saying that we're going to guarantee that we'll predict your flu or predict COVID-19? Like that's risky. We have the power to start, educating folks on that and getting to the point of having some pretty powerful models, but it's not perfect. And you're toying with people's emotions and like saying like we can, help you with diseases, and that can become very heavy if you deliver false promises. So yeah, it's a delicate balance or delicate dance. So yeah.
Sure. Great. So last question, we're almost out of time. What do you view as the absolute cutting edge of AI in healthcare?
I do think like the diagnostic field, like I said, like just kind of what I was alluding to, like with COVID-19 and like what are some of the predictive capabilities. Like I do think that if we can get ahead of cancer diagnosis, like that's like some of the stuff I'm most excited about is like the power of AI around cancer detection. Cancer is a really rough disease. It's horrible. It takes too many lives every year. So if we can use the models and the data computing power that we have at our disposal to, predict even like maybe even before you're born, we can, with genetic, capabilities, predict what cancers you might be predisposed to and put you on a regimen to, predict what cancers might happen to you in your lifetime, because we know you've got certain genetic makeup that's going to make you highly likely to get that. So, and there's a combination, there's a balance again of like unnecessary anxiety or like, like overdoing it and like trying to protect you from everything that's ever going to happen, because that's just not possible. But yeah.
Cool. Well, we are just about out of time. Patrika, are you still with us?
Of course, right here. Just enjoying this incredible session. Thank you both. This has been absolutely awesome. And I know this virtual audience is going wild with virtual applause. Thank you again for sharing these incredible insights with us, Amit. And for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our awesome AI exhibits. Thanks so much, and we'll see you around.